Hello, and welcome to the Talk of the Town. I'm Michael Jacobi from KCAT Radio, and with us today, a gentleman who was a guest a couple of years ago, and we've decided to have you on the air until I pronounce your name correctly. So this could be the beginning of a 13-week series.
You're right.
Dr. David Ghilarducci.
Ghilarducci, yes.
Ghilarducci,
yes.
close
Thank you.
enough.
Pretty good. It's a tough
I've
one.
got to have you on again.
Yeah.
From O'Connor Hospital. Great to see you, buddy.
Well, likewise.
Since we last spoke on this show, I had you on my radio show.
Yeah.
A couple of times. And, it was great to have you.
Thank you.
The medical business these days is, I guess you could describe it as a bit of the jungle.
Yeah, I would think so.
Yeah. We'll see where that goes. Anyway, first of all, thanks to the good folks at O'Connor Hospital, and you're representing them today, part of Verity Health. You have been interviewed, I'm sure, over your life. This is hardly your first rodeo.
Right.
But what have you always wanted to have been asked that no one's ever asked you?
Oh, my Lord. Boy, this is like a tough interview question, right?
If I had others, I wouldn't have to open
Well,
it.
that's right. What would I want to be asked? Well, I think I could tell you what I often get asked. Okay. I don't know if that answers your question, but I often get asked, I think I'd mentioned before when we were on the show that medicine is my second career, and it started out as a firefighter here in Los Gatos, as a matter of fact.
You came to the jungle late.
I came to the jungle late, yes. I was one of the old guys in medical school.
Well, that bears repeating. Talk about your years. You were certainly a firefighter in some pretty important times in Los Gatos.
Oh, yeah, absolutely. Right. Very important times. It was at that time called Central Fire District. And Central Fire District was kind of a conglomeration of smaller fire departments like Campbell Fire Department and Los Gatos Fire Department and some of the county areas as well, Saratoga, Cupertino. We all got together and formed a single fire department many years ago. Mm-hmm. And really fascinating group of people and fascinating place to work. Exciting things. We have a lot of hazards here that...
So you started after college?
I started after college, right? Yeah.
Where was your original four-year program at?
Oh, good. So I'm a graduate of Uncle Charlie's summer camp.
Okay.
UCSC.
Yeah.
No, actually had
It's like my radio KSCO, keeping seniors occupied.
Oh, there you go.
But I know that feeling.
Okay. So at UCSC, actually I started out as a volunteer at Gilroy Fire Department.
Oh, really? Okay.
Gilroy High School grad, and really loved the fire service. I found a university that had a fire department. UC Santa Cruz was one of them. Mm-hmm. And went there and started studying. I started out with biology, and it ended up being a biochemistry major. And so I had a real love of science, but also in fire as well. So I kind of carved out a niche for myself in the fire service as a hazmat specialist.
Okay.
And so I actually came over here to Central Fire, now it's called Santa Clara County Fire, and worked as a hazmat specialist initially here. And my job was to go around town and inspect underground gas tanks and go to the semiconductor fabs and make sure that they're using their toxic gases appropriately. Really kind of an interesting time. We had a hazmat team that used to be based over at Quito Station on Saratoga-Sunnyvale Road, right near Quito Road. And so I was part of that team as well, and we would respond to chemical spills and fires and all that sort of thing.
Well, and then the whole world of emergency fire services and hazards changed one day in October of '89.
Oh, yes, right. And I may, forgive me if I've told this story before, but I was sitting at the station at Lark and Winchester, and when that thing happened, it was close to 5 p.m.
Did you drop your donut?
Yeah, right, my donut. Right. My first thought was I was sitting in my pickup truck, and my first thought was that all the mechanics over there were jumping up and down on my tailband. That was,
dear God, please.
Instead, they were cowering in a corner. We had this fire engine up on lifts, and light fixtures are coming down, and it was an interesting thing. Yeah. But it was one of the quietest times on Winchester Boulevard because everybody pulled over thinking they had a flat tire.
Yeah.
It was really amazing.
And so from that day forward, though, I mean, you really weren't, I mean, you may well have been prepared, but you really hadn't gone into actually doing the things you were preparing for until that day.
Yeah, as a matter of fact, I learned something about medical triage that day that was really interesting. Was we had planned on what to do during a fire, during an earthquake, and pull the fire engines out, get ready to respond on calls. We hadn't really planned on how to deal with the injuries associated with that. And so we had situations that day where we didn't have enough ambulances. There was, a waiting list on 911. Can you imagine that, calling 911 and put you on hold?
Yeah.
And so we had a waiting list, and so the strategy at that time was anybody who had any kind of minor injury would get put in the back of an ambulance and driven to the hospital, and there was no prioritization or anything like that. What we learned from there was, well, maybe we need to reserve these ambulances for the more serious cases, and the simple cuts and bruises and broken bones we'll do first aid and get them to the hospital another way, because we simply didn't have enough ambulances.
So how would you reserve them at if an earthquake hits, immediately that rolls into a protocol of saving ambulances?
Yeah, right. And actually changing the triage criteria, the prioritization criteria that we would use. We really didn't have a plan for that. So we learned a lot of things from that earthquake. Absolutely.
Incredibly, there's a generation since that earthquake.
I know, isn't it?
Somewhere someone's watching, like, what happened in '89?
Yeah, '89. Oh, World Series.
Yeah, that's true. Okay, so that was the. I guess that was your test of fire.
Yes. Yeah.
How soon after that did you say, "Well, I'm on the calendar and I've conquered this career"?
I took another. I guess it would be another 17 years, I think. After
now,
that.
how old were you when you started medical school?
I was 34.
34.
Most of my classmates were straight out of college, early 20s. Yeah. And so, I felt like 34 doesn't sound like very old, but in that setting, I felt that way.
Now, what did your service at the fire department and your background, obviously the biology background, did that prepare you for medical school?
It did. Although it's interesting, to the science part of it, everybody needs to get into medical school.
Sure.
But being a doctor is much more than just being a scientist, although it's a big part of it. There's other parts about being a physician that are as important, and that's about human interactions. It's about understanding and empathizing people and their different socioeconomic conditions. It's about having some exposure to the world, I think, is really important. And a lot of other countries train their doctors straight through. They start, they're sort of fast track. They start their first year of college and end up a doctor within 6 years. And in the United States, you really don't enter medical school until after going through a bachelor's program.
Yeah.
So and
the idea is a social maturity, I would imagine.
I think yes, right.
We should point out that David you're the head of emergency.
Well, yes, actually, I've relinquished that title to my partner.
Okay.
Are
you Supreme Allied Commander now?
Yeah, right.
We haven't moved you up?
Just call me Ike.
That's right.
I'm now the director of quality for our emergency department group.
Okay.
Yeah.
All right.
So
it does beg the question that, and I know anyone who's a doctor, give me a break. We go to school long enough. But if you were to have 6 months of a mission of just, like the Peace Corps, of dealing with people,
sure,
I would think it would be a profound effect.
Oh, absolutely. I learned, I did a brief stint in Haiti just after their earthquake in 2010, as I remember. And I had worked in inner city, United States, inner city America as a resident and dealt with the poverty and the issues that come with that. But when I went to this third world country that was devastated by this earthquake, that had no medical infrastructure even before the earthquake, it really opened my eyes to what medicine is and what it is in most of the world. And the fact that I can't just order a CAT scan, that I have to, really rely on my diagnostic skills, my physical examination. Yeah. And that was a real eye-opener. And also realizing that in many cases, there wasn't anything I could do for some of these people.
Well, it must be something about yelling, "I need this stat," and no one's showing up.
Yeah, right.
It's another world.
Yeah.
We're talking to Dr. David Ghilarducci, and don't correct me, from O'Connor Hospital. And a big thanks to the folks at O'Connor Hospital for sponsoring Talk of the Town this year. They're part of Verity Health. Let's take a moment to hear a little bit about them.
At O'Connor Hospital, we're restoring health together. Step by step, together. Because care is better together. O'Connor, together in health. At O'Connor Hospital, we're shortening your wait time. Because in an emergency, every minute counts. This is our commitment to you. O'Connor Hospital, together in health.
And welcome back to the Talk of the Town, sponsored by the good folks at O'Connor Hospital. With me in the studio, Dr. David Ghilarducci. I'm getting close. I am. But that's all right.
Yeah,
You know,
close
it
enough.
gives you something to talk about.
Right, that's right.
Who is not the head of emergency. What's the new title du jour?
I am the director of quality.
Director of quality. I like that.
Yes, our quality director. Ed.
You know, it's the kind of thing, it's vague enough that you can kind of float through a day and going, hey, working on some quality here. Coffee's pretty good.
Yeah, that's right.
Okay, so let's talk, and you were so very eloquent last time, you are as well today, but talking about O'Connor. And I want to take a moment to talk about the hospital
Yeah.
and talk a little bit about the background that it was founded by a group of nuns.
Yes, that's
originally,
right. The Daughters of Charity. And I think I spoke earlier about Haiti. I was surprised to see they were there too.
Were they?
They had a presence in Haiti.
Now, Haiti is such what's the other side of Haiti? Dominican Republic, right?
Dominican Republic.
And
right.
it's like, I don't know what they did to anger God, but it's like one side never has any problems.
Yeah.
And it's the hurricane's aim there and the earthquake.
I know.
It's amazing.
It's the mobile home park of the Caribbean.
Yeah. and just abject poverty.
Yeah. Yeah, it really is. And I think the history of Haiti is interesting. We don't have time to get into it, nor am I an expert, but it's, many years of different sort of puppet governments and the Marines were there 100 years ago, trying to stabilize that place. So this is a long history.
So we talked about the nuns. Is it Daughters of Charity?
The Daughters of Charity.
Daughters of Charity. Now, is that like the Franciscans? I mean, it is.
It's like an order, or
it's an order,
like the novitiate here in Los Gatos, and so an order of nuns, Catholic, of course, who founded the first hospital here in San Jose. In fact, they founded the first hospital in Los Angeles, St. Vincent's.
Really?
Yes, that's part of Verity as well.
Okay.
And so interesting history, sort of early on. Their mission, of course, all along was charity care, providing care to the poor. They were essentially our safety net for many, many years.
And what's the relationship to the order and the hospital now?
Right. So the Daughters, I'll refer to them as the Daughters, were wonderful, giving human beings, and really believed in their mission. But in terms of business management and dealing with
those nuns,
dealing with the insurers and the payers and the costs and the unions and all the stuff that you need to do for a business perspective, they realize that healthcare has gotten too complicated for them.
Forgiving those that trespass is not good business.
Right, there you go. Yeah.
So the relationship now is is there a relationship still?
They are no longer a part of the hospital system.
Okay.
It's been passed on to Verity, a new group that.
And Verity is a management group.
Verity is a management group.
Okay.
Right.
All right.
Yeah. So and Verity is continuing the same mission as the Daughters, but attempting to do it in a financially sustainable way.
Was your first health care organization that you worked with O'Connor, or where else did you work?
I was at Kaiser for
were
a
you?
couple of
Okay.
years. Yeah, up in San Leandro.
And what does a group like Verity bring to the table?
Well,
Or to the gurney, as the case
yeah.
may be?
So they're playing a lot of catch up.
Okay.
So over the years, our hospitals have had some underinvestment in infrastructure and lots of issues that. So they bring the professional experience, the talent and depth to right the ship, so to speak.
Okay.
And so we're seeing very tremendous progress and continue to focus. Our primary focus has always been on patient care and patient quality. That's one of my jobs, right? And making a financially sustainable kind of operation so we can continue on that mission.
It's, the cliche that it's a new world in medicine, I guess, applies every day. And it's a constant.
Yeah.
Is that the toughest part?
The business of medicine is tough
Yeah.
because most of us didn't go into medicine thinking about it from that
business.
perspective. It was more about, the wanting to help others, being in a position to that. But, unfortunately, the nature of medicine today, I spend 50% of my time doing documentation and charting and that sort of thing. And only about half of my time is actually spent with patients themselves,
So you still keep a patient load?
I still keep a patient load, yeah.
Now, being in charge of quality, do you have to carry malpractice from that from patient coverage, but from that angle, if as an administrative?
No, not. I don't think I have direct liability, but my insurance coverage.
So if air quality's down, they can't sue you.
Right.
Yeah.
That's
He's
right.
a quality guy.
Yeah,
What's up with that?
Right.
We're going to jump around a little bit because it's the nature of the show in my mind. But you grew up in Gilroy. Did you do any forest firefighting?
No, I didn't.
Okay.
Other than as an urban firefighter who occasionally gets called into the forest.
Yeah. Okay. Yeah. But there's another ball of wax.
Oh
up
yes.
There.
Very dangerous work.
And we get a lot of fires during the summer along that corridor
Yeah.
at Morgan Hill, Gilroy.
Absolutely. And then we have a lot of heavily wooded area on the east side, on the west side of the valley, like we do above Monteserino, above the hills of Los Gatos. We've had some significant fires near Lexington Reservoir, near the Cats.
Yeah.
Yep.
Most daunting story that happened to you?
Oh well, it's a good question. I was reflecting back my early days as a firefighter. I was in Santa Cruz, and we had a fire in a dormitory. It was on the 4th floor. Whenever you have a fire above the ground floor, there's a lot more complication involved in that. And I remember as a new firefighter and having an even newer partner with me, climbing up the stairs, and I've relived this moment so many times. But the procedure is you pull up, you put on your air tanks, you carry this hose on your shoulders, you carry that up the stairs to get to where the fire is. And the procedure is you hook in the hose on the floor before. There's a big pipe in the stairwell, and you hook that in, and you advance the line, and then you turn on the water, right? So I'm the guy on the nozzle, and I'm up the floor, and my partner's down below, and he's hooking in below, and we're getting ready to go in, and he turns on the hose. And right now, the hose is all in a jumbled mess on the floor. And suddenly this hose is full of 200 PSI, and it's wedged in the handrails, and there is no budging this thing, right? So we're having to untie this mess, and it's black, there's smoke, we're breathing off of air tanks, and we got about 10 or 15 feet down the corridor when our air ran out, and we had to turn around and go back and get more.
Was this post 9/11?
No, this was back in the 80s that this happened.
Okay.
Well, that was probably one of my scariest.
Now, I would think, you talk about walking upstairs, I would think post 9/11, that photograph has got to be burned in a firefighter's mind.
Yeah, climbing up those stairs when everybody else is coming down. That's kind of the mantra of firefighting is when everybody else is rushing out, we're rushing in. Okay. And those guys going up to that, there's no escape from upper floors, right? And unless that stairwell's intact.
Yeah.
And so that's your rescue corridor. Now, when those planes hit, they disrupted those exit ways, where people above those had no access down. And in many cases, and obviously when the buildings collapsed. Then, now, the one there were some firefighters that survived the collapse. And they
rode the building down.
In a way, they were in some of the lower floors in a stairwell. The building collapsed around them, and they were found later and survived it. Just incredible.
Most touching story, that's the most rewarding. Did you ever shoot a cat out of a tree or anything? I'm kidding.
Well, we have
I'll get him.
yeah, we have an old saying in the fire service that you never see cat skeletons in trees. So yeah, that is a classic, right? The cats get down. They figure it out.
That's right. It's like, trust me, he won't starve to death.
Yeah, that's right. He'll finally find a way down.
Yeah.
Touching stories, I'm sure there are many. You caught me off guard, but I just think more generally when the times when you can really help somebody. If you, a car wreck where you cut them out of the car and you get them out. Certainly in the hospital where, you have a save that's not expected, or you make a diagnosis that's kind of hard to make, that really makes a difference in somebody's life.
You have, and we've known each other for a while and spent some time together, but you strike me as someone that is as proud of how they do it as in addition to what they know. I mean, your bedside manner, it's got to be great pleasure to you.
Yeah, I think that's the most positive part, is making a connection. Emergency medicine is a little difficult.
It's kind of ships passing
It's
in
a
the night,
very
one of the
short-
ships is on fire.
Yeah. It's a very short interaction. Usually the patients are under duress. It's not a checkup.
And he's thanking the next guy.
Yeah, right. So there's all of that. And so it's a challenging environment from that perspective. And emergency medicine, I talked about the daughters being kind of the safety net. And I think of emergency medicine as the safety net of medical specialties.
Right.
We treat sick babies. We treat elderly people with neurologic emergencies, heart attacks, pregnant women, everything across the board. We're one of the few specialties that actually sees every gender and every age group. And so, and when we see them in a challenging condition.
This is a very neophyte, but whereas a paramedic's job is to get them to you,
yes,
your job then becomes to get them to safety or to get them stable.
Yeah, right. Well, I think of the paramedics as an extension of ourselves in a way. It really is a team effort.
Yeah.
And there's some things that the paramedics, the best thing they can do is load and go, where the most important drug that they carry is diesel fuel.
Yeah,
right. But there's other things where we want them to stay and do what they can on the scene. Like I'm thinking about cardiac arrest, which is a number one killer in the United States, number two killer actually statistically.
That begs the question, what's number one?
Oh, number one, cancer.
Okay.
Yep, yeah. So cancer, heart attacks are number two, heart disease overall. And in those situations, we want them to stay and maintain good resuscitation efforts, that the process of loading that patient, putting him in the back of the ambulance, actually interrupts the care that's most important at that time. And if there's one message I can tell your audience, the most important predictor for survival of out-of-hospital cardiac arrest, bystander CPR.
Okay.
That is the most important.
Good. And that's the traditional, or it seems it changes frequently?
No, that is it. If we, I look at survival statistics all the time for out-of-hospital cardiac arrest. And for those patients who are discharged from the hospital following one of these events, who have good neurologic outcomes, that is, they didn't suffer any brain damage during the arrest, it's because they had early intervention by a bystander. Even before the paramedics or the fire department gets there, we need somebody on there pushing on the chest.
David, thank you.
Of course.
The quality of life around this town is a lot better because of you.
Oh, thank you,
You're
sir.
watching the quality. That's Talk of the Town. Thanks to the folks at O'Connor Hospital, part of Verity Health. And delighted to have you with us again, and look forward to seeing you soon. Until that day comes, I'm Jacobi. I'll see you soon.